Now
9 out of 10 doctors.
Understand.
What's up with that
I
one
have
doctor?
done all that I could.
I remember the Dentine commercial. Was it 4 out of 5 dentists choose Dentine to their patients when chewing gum? I mean, seriously, don't you think Dentine or the Wrigley Company, whoever had that, don't you think they would find the 5th doctor who just says yes to make it 100%? God, it just never made sense to me. 9 out of 10 doctors. 9 out of 10 doctors listen to KPRC Radio. Who's that 10th doctor? I don't know. Well, I do know all of the doctors over at the Altus Healthcare. Choose Well, Choose Altus, ALTUS. They do listen to the KPRC Radio, and that's because they're generally on air with me every Wednesday right about this time. We spend a few minutes with one of the doctors from Altus. They talk about an issue that it's important. It affects a lot of folks. Today we are joined by, I like this one. It's a great topic and a great doctor, Dr. Alexander Mohr. Alexander Mohr advances in orthopedic spine care. Dr. Mohr, appreciate your time. How are you today?
Very well. Thanks for having me on.
Well, no, listen, thank you. You got some good information over here. You're a board-certified orthopedic surgeon, American Academy of Orthopedic Surgeons, member of the North American Spine Society, Lumbar Spine Research Society. That's a big business card, my friend. Tell me about the types of patients that you see in your practice.
You know, unfortunately, back and neck pain is a huge problem for people in our country and around the world. And it affects people of all different ages. I see, relatively younger kids, basically from 12-year-olds all the way up to, 90, 95-year-olds. So it's nice for me. I get to see a spectrum of people.
Is this? Can you pinpoint anything specifically? Maybe even for the age. Is it something that they're born with? Is it the way they sleep because they've got a bad bed? Is it sports related? Are you just all across the board?
Yeah, it really is all across the board. And it really depends. I mean, yeah, certainly there are some things that people are born with that cause them problems and lead them to be more likely to have back pain. But a lot of it is, a little bit of it's bad luck, and some of it's, not eating right, not getting enough rest, and not taking good care of yourself. So it's really a spectrum.
I'll get into my back. I'll break the HIPAA rules since I'll tell you a little bit about my back a little bit later. But I'm a big technology guy, and I love the research and development and advances in everything that has to do with medicine. And there have been so many advances, Dr. Mohr, in spine care, surgery lately, spine surgery. I mean, it used to be a really major procedure. I think we have things like minimally invasive spine surgery, artificial disc replacement. Talk about how you've seen these procedures have changed.
Well, it's really been a major force in improving of healthcare. Minimally invasive anything. It really started with the knee scope. It used to be that people had really large incisions, and now there's small incisions and small portals, and people are getting a lot of the surgeries that were 2 and 3 hospital day stays are now done as an outpatient. And I think it's incredible, and it's really been a great pleasure for me to see some of the benefits for people. They get smaller incisions, smaller scars, they develop less scar tissue, they have less pain, they recover more quickly. And that's what really people want. They want to return to their work and activities of daily living and getting on about their life as quickly as possible. They don't want to be slowed down and held up. And that's one of the things that I have been so pleased with minimally invasive spine surgeries, that people can get on to their life more quickly.
Dr. Alexander Mohr joining me here for a few minutes. The Altus Health Update, advances in orthopedic spine care. Let's talk about sports. So many people suffer from sports, work-related injuries too, especially with the back. Tell me about some of those. More importantly, the treatments that you provide. I mean, this could be sometimes do you have any Tiger Balm, or do you have anything that'll rub, or do you really have to go into the minimally invasive or even something worse than that? Start with the sports and work injuries.
Well, in the end, my goal as a spine surgeon is to try to give people every opportunity to get better without spine surgery. And that sounds sort of counterintuitive, but, is trying to be not just a surgeon, but actually a physician and somebody that cares about the people that see me because they're my patients. spine surgery is something, no matter how minimal it is and how much better it is than it used to be, it's still a risk. There's a risk of anesthesia, there's a risk of infection, there's a risk of different things. So we try to start with the easiest, safest methods possible. So, fundamentally, we do medications. We ask for physical therapy. We'll talk about, potentially getting epidural steroid injections or facet blocks, things that aren't surgery. And if all of those things don't give people the relief that they want and their symptoms are bad enough, minimally invasive surgery is a great thing to maybe take it to that next level, and it's a much less commitment than the bigger previous surgeries. So I think it's a great improvement for folks.
Talk about preventative measures, and I say this it's because I'd like to think I'm pretty active. I mean, I'm a runner, and I started to work out. I never used to do. And this is what a lot of the trainers and a lot of doctors say too, you got to work the core. You got to work your stomach muscles. You got to work that, because if not, the back is just going to go. And I'm telling you from experience, when your back is gone, your life is almost over. It is massive, massive pain. Years ago now, I started building that core, building the stomach muscles. And I will tell you this, I've had fewer and fewer back issues. And so recommendations that you would give to people, sports, everyday people, if you work and you have to do some heavy lifting, how would you try to prevent back injuries?
Well, and I think an ounce of prevention is worth more than a pound of cure, and that you bring up a wonderful point. So just what you talked about. I think that if you look at what people should do to avoid injury, I think one is make sure they're in good aerobic conditioning. Try to figure out something to get your heart rate up a minimum of 3 times a week for 30 minutes at a time. Work on your core strength. And I don't want to dissuade anybody from doing anything, physical, but do it gradually. If you go on the TV and you buy one of those really great videos that shows you everything, well, if you're going to do that, make sure you work into it slowly, because I have patients that jump in and hurt themselves. So a great way to start is to see your primary care physician, see somebody like me, get a referral to physical therapy. If you're a member of a gym and you're interested, talk to a personal trainer, and they can show you some of the exercises and go slow. And, gradually increase your core strength, because, just like you said, and unfortunately you've noticed this in your own life, the strength, as you increase it and your core strength goes up, you hurt less. And that's a really great return on your investment.
Dr. Mohr, Alexander Mohr, great information. I know a lot of people. I already got 2 emails right over here. Where is this guy? My back hurts. Like that. You do have an office, I believe, in Cyprus. You have another in Houston. You see patients from all over the region. Where pretty much do you get? Are your offices? Phone number and website so people can get a hold of you.
Sure. Well, I really again appreciate this opportunity. My last name is spelled kind of funny. It's Mohr. It's pronounced just like Mohr, but my website is drmohr.com, and I have 2 offices. Though I'm pleased to see anybody from anywhere, and I'm trying to increase this. But I have 1 office in the North Cyprus Medical Center complex. And then the next one is in the Willowbrook area in a professional office building there. So if you go to the website, drmohr.com, you can find that information, and I would be very pleased to help in any way I can in reducing your pain.
And real quickly, how about a phone number?
Oh, sorry. Perfect. So it's 281-955-7577.
281-955-7577. I'm just taking from experience, my dear listeners out there, man. Take care of your back. If your back goes, man, you are laying up, and it is not funny. Dr. Alexander Mohr, Mohr. Thank you very much for your time. I appreciate that. I'd like to say, hopefully, I won't have to call you in the near future for my back, but I know who to call. God forbid something goes out of whack.
Well, hey, I appreciate it. Keep doing that core strengthening. You'll stay away.
I love it. Doctor's orders, I will do. Dr. Alexander Mohr. Listen, thank you very much, and thank you to Altus. Altus, choose well, choose Altus. Altus, great doctors all over the area. On the other side, Rutgers fires at coach. They knew something bad was going on for 3 years. Why?